If you are looking to replace missing teeth, dental bridges can be a well-known and reliable choice. A dental bridge is made up comprising two crowns or more, which can be placed on opposite sides of the gap that is created due to missing teeth. The bridge is topped with an artificial tooth, known as pontic, between. The bridge is then bonded in place and restores the functionality and look that your teeth have. There are many different varieties of bridges for dental use that may be employed according to the needs specific to the patient. The video below will look at the various kinds of dental bridges and their pros and cons. Traditional dental bridges. The most commonly used form of dental bridge is the standard dental bridge. It consists of two crowns that are put on the abutment teeth at either end of the gap. They are joined by the pontic in between. The traditional dental bridge is typically composed of porcelain that has been joined to steel. This offers strength and beauty. One of the primary benefits that traditional dental bridges have is the fact that they're durable and durable. When properly cared for and maintained, an old-fashioned dental bridge is able to last for 10 years or even longer. Furthermore, traditional bridges are reasonably affordable when as compared to other forms of bridges used in dentistry. But a drawback to conventional bridges for dental use is that they need the dentist to shave some of the enamel from tooth abutment to accommodate the crowns. The removal of enamel can reduce the strength of the abutment teeth as well as increase the likelihood of developing infections or decay. Cantilever dental bridges. Dental bridges made of cantilever look similar as traditional bridges for dental use, however they're supported by one tooth instead of two. The type of bridge usually used when there's just one natural tooth next to the space. Dental bridges with a cantilever design is a great option if there's only one abutment tooth. However, they're less durable and stable as conventional dental bridges, because they are only being supported from one end and has a lower possibility of damage or even failure. Maryland dental bridges. Maryland dental bridges, sometimes called resin-bonded bridges, are less intrusive for traditional bridges. Instead of crowns, Maryland bridges make use of either the wings of porcelain or metal connected to the back of adjacent teeth. One of the biggest benefits that comes with Maryland bridges is the fact that they don't necessitate removal of the enamel from the teeth that abutment them, thus making them a much alternative that is more sensible. Maryland bridges can also be more affordable than conventional bridges and may be repaired easily in the event of need. One disadvantage to Maryland bridges lies in the fact they're less durable and strong, unlike the traditional bridges. Maryland bridges tend to be utilized in front teeth that have lesser pressure and force, since they might not be capable of enduring the force of chewing that is present in back teeth. Implant-supported bridges. Implant-supported bridges are thought to be the most durable and reliable form of dental bridge. Instead of using nearby teeth to support the bridge, implant-supported bridges are secured in the jawbone by dental implants. Implants are made of titanium that are surgically inserted within the jawbone. They are there where they join the bone to provide a sturdy base for a bridge. Bridges supported by implants are exceptionally sturdy and will last for many years if they are properly cared for. One of the primary benefits of bridges supported by implants is that they can prevent loss of bone mass in the jaw. This could happen when teeth are missing. Implants are also a natural-looking and feeling replacement that like natural teeth. The only drawback to bridges supported by implants is that they're more costly and require an extended treatment time. The procedure for getting dental implants could take a few months, as implants must be able to integrate into the bone prior to the bridge being able to be put in place. There are many different kinds of bridges for dental use that can be used to fill in the gaps left by missing teeth. Each one has distinct strengths and cons, and the most appropriate choice depends on the individual demands and needs for the person. The traditional dental bridges are long-lasting and inexpensive. Bridges that cantilever are a great choice for single abutment teeth. Maryland bridges are a budget-friendly and affordable option. Implant-supported bridges are also the most durable and reliable alternative. You should consult with your dentist about which option that is appropriate for your specific situation.